All right. Hello, everyone. Welcome to this episode of the Sink and Swim podcast. Today's guest is the kind of person who reminds you that healing is not linear, ever. Rebellion isn't reckless, even though you might have been conditioned to believe that. And your intuition probably knows what the hell it's doing as long as you can just safely tap in and listen to it. Dr. Jessica DeJarnette, aka Dr. Jess, is a lifelong nomad, a doctor, a daughter, a sister, and an auntie to many amazing little ones. She's originally from the land of sweet tea and fried chicken, same as me, and now settled in San Francisco. She is a bridge between the rational and the magical worlds. She's an integrative primary care physician with a focus on mental health and addiction at an inner city clinic for the underserved, which I love. She's a burnout coach for healthcare workers, which I love even more. She's a co-founder for a startup working to change the way we heal from trauma, which I love the most. And she's wild to her core. She's a trained forest bathing guide and has been carving her own unique life since she could walk. And she's most content while roaming free in unfenced places. Me too. And helping people break away from the wounds and stories that keep them stuck. So welcome, Dr. Jess. Thank you for being here. I'm so excited that you're here.
Thank you for having me, Julie. Such a pleasure. So excited.
You know, I love this summary of you, which you wrote, not me. And I'm so happy to be able to pass it along and share it to our audience. And what I love about it as I read it was, I was like, yeah, I have always known that about you. So for our listeners, we've met through a mutual friend at our mutual friend Ashley's wedding, actually. And, or maybe before that, I don't remember, but it was somewhere in that time of life. Yeah. Like post-college world, grad school. And I remember just seeing that in you, that carving your own path vibe, and I loved it. I was not in that vibe in my life at that time, and I think I really looked up to it. I think I really admired it. So
thank you. Yeah, no, it
so
was funny story, anecdote, really, that'll give you some insight. When I was a child, I was so desperate to be different from everyone around me, even at the age of I was in elementary school, probably 6 or 7, and I was definitely born in Georgia, right? Like I born and raised.
Right.
My parents had lived in Texas before I was born. I was conceived in Texas. To my, young brain, Texas was very exotic. And so I decided I was going to tell people I was born in Texas. Because I wanted to be so different. Everyone around me was born in Georgia. I was born in Georgia, And so I told this little white lie for many years. And eventually my family found out. And still to this day, I'm 41 years old, harasses me about my made up birthplace. At some point I decided to start telling the truth. I've just always wanted to be different.
I love this.
I can remember.
You got to forge your own trail. And if that means making up where you're born, great.
Could have been more.
You could have been. I mean, conceived there. It depends on our definition of life, and we're not going to get into that. But yeah. Okay, I love this. What I also love is I was born in Mississippi, but I tell everyone I'm from Georgia. That's like a little detail. So I'm like the opposite.
Yeah,
this little detail that never makes it into the story. So while we're here, telling the truth about where we were actually born, it's important. Well, okay, we have lots of things to dig in today. We're going to dig into your story about being a physician and how you have really redefined your role there and used that to springboard all sorts of new parts of your career, which I love. Your own personal journeys, walkabouts that have changed everything. We're going to get into the mystic side of you, which I just adore, and even your feisty female leadership side. So lots of things to dig into. But first, tell us about, so what I didn't mention in your intro is you were trained or started to train or have a background in the emergency room. And then you left there and chose a different path. So yes, tell me about it.
Yeah. So, when I started medical school, I was the person loved everything, right? I loved, at first I wanted to be a neurosurgeon, and then I wanted to be a pediatrician. And, I just was so fascinated by all facets of
Yeah.
medicine. And, eventually you have to choose a path, right? And so for me, ER was a natural progression. I love procedures. I loved um, the fast pace, the adrenaline. I mean, to be quite frank, and we can dive into this a little more, but I wanted to be a hero, right? And I was
Yeah.
quite addicted to that feeling. So there's definitely a bit of an ego piece there.
Yeah.
And looking back, you don't really see it in the time. And yeah, I have a very quick mind. And so I liked, being able to like quickly make decisions and triage. And it was very exciting. And, you can do anything as a student. I always say, right? You can do anything for a couple of months. And it was really fun as a student. And I was super excited. I loved going to work. So passionate about it. And I also have a degree in global health. And so I really wanted to work internationally and, work on bringing critical care to, scaling up critical care in low and middle income countries. That was my path. And, as I entered residency and started, shit got real. To be honest, like you go from being a student and just sort of learning for the sake of learning and experience. And then suddenly you're thrust into everything's on you. And when I say everything, like obviously as an intern, you have your attendings, you have your residents, but the hospital where I was working was quite busy, a very busy trauma center. And my first rotation was actually trauma. And I was put in some pretty horrific situations I was not at all prepared for, despite my many months of training, and I really started to question, is this how I want to spend my life? Like every day, I realize in the ER, everybody in the ER it's like the worst day of their life or one of, right? Like no one wants to be there. Like it's always some dramatic situation for the most part. And it really wears on you after a while. I think like certain personality types can handle that and are adept at, the boundaries there. And I started to realize I just wasn't, I took everything home with me. I started not sleeping. My health was suffering. I know now I've had PTSD for a long time, but it was really triggering it in the worst way, and I was becoming anxious every shift. And I realized eventually, I can finish my training. I could do this for a few years, but I cannot do this for 20 years, 30 years. I can't do this my whole career. I will not survive. I'm just, at the time, I didn't know about, nervous system regulation and, the different states of activation and such. But, just living in that sympathetic overdrive for months, years on end, like I couldn't do it, and so I had a situation with a male supervisor who actually was bullying me. Not pulling a victim card here at all. I really like this situation was really terrible. But at the end of the day, it was the best thing that could have happened because that was really the catalyst that led me to walk away. I think if that had not happened, I would have stuck it out. I would have stayed where I was, tried to prove myself, but that really was like the straw that broke the camel's back for me, where I didn't have a choice. There comes a point, I think, in a lot of people's careers and situations that are harmful to you where you literally know you can't go on and you don't know what's next, but you know you can't do this. And so I made the decision to leave at the end of my intern year. I had no plans. I had no job. I was not switching to another residency. I didn't even know if I wanted to continue in medicine. I just knew I had to get out, and I did. And it was the best decision I've ever made.
Oh my gosh. I'm so glad you got out. I'm so grateful that you see that dark place is the catalyst for your rebirth, so to speak. I so resonate with the personality trait of you love everything.
Yeah, it's pretty obvious.
When you said that, I was like, oh, I feel seen. I guess I'll just have to pick one track though. And I think I just wrote a post about that was like, well, I guess I got to pick a track because that's what you're supposed to do. And you can never contain that type of trait.
Society loves to put us in boxes, right? And we do it to each other too, right? It's easier for our brains if we can categorize people as a certain thing. our brains are constantly sifting and sorting through information all day long. And,
Mm.
from a company perspective, right? Like you hire someone for a defined role, and that's where they are. That's what they do, right? And so, it's society has really groomed us into, you've got to be this one thing. You've got to pick one path. And I do think, there's so much to be said for focusing, right? Because if your energy is really scattered all the time, it's really hard to get things done. And I've struggled with that my whole career. But at the same time, we're not all wired the same, and we don't all have one life path. And I'm really excited that you are bringing such attention to the fact that, a lot of us are created for multiple different paths, and that's okay. And, it's very needed, that this other voice in the space, you know what I mean, for people to be able to create their own journey. So, yeah.
Yeah. So beautiful. Thank you for that. Slight tangent.
Mm-hmm.
And then I have a question.
Mm-hmm.
I love that you said that society really likes to label us because that's how our brains are wired, that 0 and 1 type of categorization.
Mm-hmm.
It brings safety, right? Feels good. It helps us feel like we can predict people and all of that. I just, a couple days ago, I'm not really into Instagram metrics, like how my posts perform or anything, but I was just looking at them and I noticed that recently mine like plummeted. And it coincides with me really stepping out and showing all sides of me. All parts, like the super, like kind of sophisticated, like likes to dress up, the muddy mountain biker, the funny, goofy, dresses up and does funny reels that are satire, and then the very serious, deep, profound thinker, like all of that stuff. And I was talking to like a social media expert about this, and they were like, well, yeah, because you don't fit in any one box. The algorithm doesn't know what to do with you.
Totally.
And I was like, oh my God, that's so true. And that's how humans work too. And it was so like affirming that I was like, well, I'm not going to change that. So I guess I just might not have great social media performance. And here we are.
That's very true. I've heard that as well. The algorithm, like, as a creator, you have to pick a lane, and
you got to be monolithic.
I know. So we all live and die by this in our brains and our devices, right?
Well, okay.
The good news.
You know what's interesting about that? And I think it's a segue into my next question, which is, as someone who's so multivariate, multi-interested, and multi-passionate, and has that, I want to be the hero, I want to save people gene, for better or worse, which you're learning. I think that, especially going into healthcare, and most of my audience is women in healthcare, that can be a really great strength. And then, of course, it can be an Achilles heel and set you up for a lot of things you're describing, of shutdown, burnout, all of that kind of stuff. So I'm curious, with your own process and your own understanding, especially you hinted at nervous system activation and regulation, all that. How would you actually define what's actually behind burnout, especially in the healthcare field? Because I think that, people might be like, oh, it's the job, or it's the, work-life balance that's not set up for, that a company doesn't set us up for success with. So tell us your perspective on that.
Yeah, I think about this every day. And so I think the best way for me to describe it is the journey of, say, I'm going to use a medical student because that's my background, the one I know best. But any healthcare professional, I think, has a similar path. And so hopefully this resonates. But you have a really empathetic and driven and highly motivated, intelligent person that wants to do great things in the world. That's really who goes into healthcare. And then healthcare is an industry that, to me, is run by fear, right? And so the fear starts early. Like, we start studying for exams. We have to keep our grades up. We, are so afraid to mess up because we've got to get into school, right? That's the first hurdle. We pass all the things, we get into school. And then when you're in school, the studying gets even more intense. I remember I literally almost failed my first medical school exam because I didn't know how to study. Like, I really didn't until I got to med school. I crammed my whole way through high school and college, and then I got to med school. I was like, wow, okay, it's time to time to take this seriously. And so then the fear drives you for that. Like you've got to, do well, you have to perform, perform, perform. And you're sort of indoctrinated into this culture of fear. And by the time you do your rotations and start a residency, you've changed as a person, right? And I look at this arc because, I have a lot of friends that are in medicine, a lot that aren't. And I sort of compare the two groups, RCT in my own mind, people I've known from a young age, early 20s to now early 40s, and how we've all changed over time. And, it's pretty remarkable to see the personality changes in my friends who've done medicine and the ones who have not. And, it's not across the board. Like not everyone has changed in a significant way, but I'd say most of us have, myself included. And, you learn to start, particularly as a resident, you learn to start ignoring your body. You learn to start ignoring those signals of I'm tired, I'm hungry, my boundaries are being crossed every single day by patients, by attendings, and you suppress to get through your day because you're tough, right? You can't show weakness. Another little anecdote, a light bulb moment for me when I was an intern in the ER. Our shifts we had 8-hour shifts, but they end up being 9 or 10 typically. No meal breaks, right? And that's not really common in ER to have a meal break for physicians, right? Like nurses can get breaks, but doctors do not. Maybe they do now. They did not then, 12 years ago. I really struggle to keep my brain flowing without food, right? I'm one of those people that is constantly snacking. Like my blood sugar plummets. I don't do well with long periods of not eating. And it was sort of frowned upon / I got some talking to about having food at my desk. And so I would go to the bathroom to pee and literally bring my peanut butter jelly in the bathroom with me and eat it on the toilet as I was going to the bathroom. And at one point I had this moment of like, this isn't normal. Like this shouldn't be okay that I don't even I'm like saving lives, but I don't even get to eat food. Like the time I'm working, Same with like rounding in the hospital. Like I would keep a bag of peanut M&Ms in my pocket and just like snack like a squirrel, like so I wouldn't pass out, of hypoglycemia.
Become a patient.
It was starting to be like this. We aren't even allowed to take care of ourselves. Like, how is this okay? And that was kind of a big moment for me. And then you throw on top of that the very, I'd say, blatant gaslighting and horrible behavior as a female's misogyny a lot of the time, right? I've had a lot, I'm sure you have, all of us have probably listening to this. And this was way before the Me Too movement and way before, the pandemic, was burnout. Everyone calls it burnout. It's trauma. Being honest, is being talked about more now. At the time, it, starting to, but not really. And, I started to feel like there's just something wrong with me. Like, why am I the only one that like sees a problem here? And I knew people around me were unhappy, but no one seemed as like infuriated by it as I was. But honestly, I mean, the pandemic was a tipping point, and that was when I kind of started to speak out about this publicly and wrote my first article about this, the fact that I walked away from my career because of trauma and burnout, and was just so done. And a lot of physicians and healthcare workers were doing the same. And, I think the pandemic, again, was like, we've all had these catalyst moments in our careers, but for me, it was a big one. For a lot of people, it was a big one. Yeah, this actually isn't okay anymore. We don't even have masks in the hospital. We're told to like make a cloth one at home. Like, that's not okay.
No, it's not okay. One of my friends who is still an ER physician, I remember him texting me periodically, right when the pandemic started. And the things he told me that he was being expected, and this is a he, by the way, not a woman, that he was being expected to do, like, it was unfathomable. I didn't even know what to say back as a friend.
Yeah.
I was just like, do you need me to come pick you up and kidnap you? Because I feel like that's the only way out right now.
Right.
But, You brought up so many, okay, first of all, like just soundbite moments that I'm like, oh my gosh, can we dig into that? But obviously we don't have all day, but I just want to highlight them, which is healthcare is an industry run by fear. That is something that I also really picked up on early. And I'm in a different part of healthcare, but as you said, it's really all very similar and parallel in terms of the journey as the healthcare provider. And I so resonate with like the fear all the way from even studying for tests and even applying to get into school. Like it really starts when you get that first idea that you're going to actually commit to do this thing. And that's where the culture starts. Because in college, you're kind of like, oh, yeah, I'm going to cram the night before and whatever. It's fine. I'll get there. You still have that freedom and that free spirit. And all of that is still alive. And then it just slowly but surely gets squashed and squashed and squashed. And then you add on being a woman or someone who's in a different type of marginalized community or something like that. And it's like even more of that suppression and gaslighting and all fear-based. And the big irony that you highlighted that I want to repeat is as a resident, as a trainee, you are literally indoctrinated to ignore your body.
Yeah.
What? And I agree. I'm still learning to tap into my body. I'm still unwinding that 14, 15, 16 years later with help, like I need help because it got so suppressed.
Right.
And 5 years into my career, I was like, why am I having panic attacks? I don't know. I don't really understand why this is here. And nobody really understood. They were like, oh, you have everything together. Right.
She's assault.
Exactly.
Yeah.
And I love that you said everyone calls it burnout. It's trauma.
This is the hill I will die on is for us to all recognize that.
I'm going to be on that hill with you.
Hey, we need more people on the hill. And that's why I literally even call myself a burnout coach, because I realize like there's still this gap of recognition. And I think a lot of it is denial. I liken the career, the healthcare career to a toxic marriage often is one of my favorite analogies. Anyone who's been in an abusive relationship or partnership, there's a lot of denial for a while, right? Like it typically takes some time, and I've been in one. So I've been through this myself, and I see the parallels of like, it took a lot of instances, a lot of time, a lot of space, a lot of like, and friends pointing things out to you. And so for healthcare, I think it's similar. I mean, we've invested so much into a thing to then be like, wow, this thing is really harmful to me. I can't do this thing anymore, right? I mean, sunk cost fallacy, like through and through. Like that's a huge shock to your system and to your whole life, which is built around this career. Like leaving ER for me, honestly, the worst part was that was my identity. I became so wrapped up. And I was an ER doctor. I'd spent years facing this goal. And when I stepped away, I had no idea who I was. I had no idea what I was. And that was my first sort of ego death of like, I am not my career. There is more to me. I can never be just one thing. So many people do this with being a mother, with being a wife, we have these labels again that we identify with and become who we are. But then that thing, and once a mother, always a mother. But when your kids grow up, move out of the house, what are you then? And it's, it was this recognition of like, I can't put all my eggs in one basket, but I can never like make one thing of who I truly am. And that was the start of my journey to like figuring out all the parts of me. And, my career is so much of who I am, and it's one of my top purposes in this life, but it will never be my full story. And that's when I really started to separate myself from what I do in the world. Because before that, they were completely enmeshed, and it was so shocking to step away from that.
Enmeshment. That's in the abusive relationship language, codependency. Exactly. I think was it the last was it the podcast episode I released yesterday? I used that exact metaphor where
Mm,
I was talking about, I think the title of it is Outgrowing the White Coat.
mhm,
And I was like, here's the thing. I mean, you can go get a certification as a coach or, start calling yourself a somatic healer, whatever you want to do. When you clue into there's something else. And the thing that, when I help people make that transition career wise, they will hold on with white knuckles to
mhm.
the healthcare practices, beliefs, et cetera, because it's become their identity, like you said, and that's housed in our nervous system. And if you don't do that work, then you can't seamlessly make that transition. It's just not going to, it's not seamless anyway, but it's just not you're not going to get to the other side because there's always going to be this one foot in the door over here in the codependent relationship.
Yeah, and another thing, 100%, but I think something that's not talked about enough is the financial
Mm-hmm.
implications, right? And this is what I found, is what keeps a lot of people stuck is the financial dependency on a certain
Yeah.
salary, right? And
Yeah.
that's often because of student loans. I mean, myself
Yeah.
included. So
Same.
I want to say my number of what I still owe in student loan debt, but most of us graduate with six figures. It's a second mortgage, right? And so it is a feudal system in a way that you're working for this system that has created a dependency on it to make this number salary. And so even, a lot of my clients have been the breadwinners of their family. And so they're like,
Mm-hmm.
I can't quit because I have these are my bills, this is what I make, I have to make this to pay my bills, and it becomes a numbers game. And so there's so many people that want to leave medicine but feel really trapped financially, and that to me is the saddest part because financial stuff is really real, and I don't think we talk about it enough as like a reason people stay stuck.
I think that, on the hierarchy of needs, it's just one rung above food, water, the very basic needs.
Right.
And if you don't have that resource or the perception of the resource, which is the same to the nervous system, whether it's actually there or you perceive it's there, you won't go. You're right. And I think, especially for women, we've been cultured not to talk about finances. And especially the woman who's the breadwinner of the family, that's its own black sheep in our culture, although it's becoming more common. And I think it's definitely okay to say, here's why I'm stuck here. And literally, quite literally indebted to this profession. And I don't see another way out. And it's not always about the pride of the
Right.
paycheck, like, oh, I don't want to make less money. There's a literal need there. And I think that a lot of times there's shame there because maybe I hear this from my own clients too. Well, I don't want to change my lifestyle.
Mhm.
Like, I've put my kids in private school. I have that privilege. I have the ability to do that.
Right.
And also pay my second mortgage for my loans.
Mhm.
And the second mortgage for the loans is still going to be there. And am I going to turn my kids' life upside down
Right.
in order to change mine?
No, it's a really
It's
hard
hard.
choice. Often, you know, it's it can be hard to that I find is the trap that's the hardest for people to get out of is the
Yeah.
financial. And
Yeah.
there's always a way, but it can require some sacrifice. So, I one of my favorite like sayings, and this came up for me in a medicine ceremony last summer was, in every situation there's a choice, right? And so you just have to make your choice. Um, Even if it's not your ideal, like sometimes it's just for a little while, or
Mm-hmm.
um, there's an end. Like when I made the choice to leave ER, I was probably a little over halfway through my intern year. I think I was 7, 8 months in. I knew I wanted to
Mm-hmm.
finish the year, but I knew I was leaving in July.
Mm-hmm.
Strength of that decision, even though it was months away, it was probably February when I decided. Um, I was able to get to that finish line because I knew there was a finish line.
You had an
I gave
out.
myself a deadline. Um, Often, if we do that, say, okay, I'm going to do this for another year. And in that year, I'm going to like prep for my next phase, or I'm going to save money, or whatever it is. That often can give us the strength to get there versus being stuck in the purgatory of like indecision. I don't know, that's a horrible place to be. And a lot of people never get out of that. And so
Yeah.
setting a deadline for yourself, even if it's months, years in the future, can be really, really helpful.
I love this because it's the functional freeze state of the nervous system that you're letting yourself have some freedom from. You're creating that doorway to actually get out of the freeze and flee, which is a much more healthy response. And I also love it because you're just going to stay there if you feel frozen and helpless. There's no option. And I love this. Like, there's always a choice. There's always a choice. And like you said, sometimes it might require some sacrifice. And I love what you said about, and it also might require you to remind yourself that everything is temporary, or it can be temporary.
Wow.
Like, I can endure this pain for 3, 4, 5 more months, a year, whatever it is.
Right.
And just creating that doorway, I think for a lot of women who otherwise wouldn't, it can, not that we have control over what the universe decides, but like it can prevent the universe pushing you out in some way that's very unpleasant, making the decision for you, like, well, you're going to go whether you like it or not, because I'm going to give you this disease, or someone in your life is going to pass, or some tragedy that forces you out.
Yeah. And I've had that, my health crises, were some of mine where it was the universe like, hey, wake up, you're not on your path. Like, let's go, and I truly think these things happen for a reason, that I was sort of forced to make a change that I wouldn't have otherwise. Because I've heard the term comfortably numb, we get sort of in this steady state of like, we're not happy, we're not fulfilled, but we're fine, and we can survive. And we stay there for years, we stay there for retirement, and two of my co-residents have passed, unfortunately, in really sad ways at young ages. One of an aggressive cancer and the other in a car accident. And, those were some of my catalysts of like, we're not all going to make it to retirement, guys. Like, nobody's guaranteed that. Right. And I see so many people and healthcare providers, particularly, like putting off their dreams and goals and everything until retirement, or I'm going to retire early, and that's fine if that's what you want to do. But, it is a bit cliche, but we never know when our last day is going to be, right? And so that is kind of how I've always lived my life. And honestly, the best advice I ever got, I remember the story just popped up in my head, but I was 14 and my family went to Alaska one summer, and we'd never been on like a trip anywhere except Florida. We would go around the Southeast, but every summer it was like the beach in Florida. And one summer my parents were like, we're going to Alaska. My brother and I threw huge fits and we're like, what? No, like we just thought of like cold and bears, and we were sun people, like not snow people at that age. Now I love the snow, but we go to Alaska. It was mind blowing, like, right? Like, it was the most beautiful place. I remember I was in awe the entire time. So grateful to my parents for forcing us. And I think that's the trip I fell in love with the West Coast or the West, and was like, I got to live here, And we were at this resort, and I met this gentleman who worked there. I was walking around. I stole my dad's camera. I got really into photography on that trip as well. I was just walking around taking photos, and he was a really nice gentleman. He was a summer worker. He had been a teacher in Boston and had a family, and they just decided they were going to do seasonal work. And so they kind of upped and moved to Alaska, and then they're going to go somewhere else for the winter. He was telling me, he was like, I don't even know how this conversation started, but it has stuck in my brain for, 25 years, whatever. But he was like, I see so many people come here, their retirement trips and cruises, and, they come on the buses, and then, they can't enjoy it for what it is. Like, their health is too poor. They can't hike anymore. He's like, they just get herded around like cattle. And he's like, I forget the exact wording, but he basically was like, you got to enjoy the world while you can, while you have your health. And that was like such an inspirational moment from this stranger that really shaped my life. Like I spent so much of my 20s and early 30s traveling, nomading. I do a lot less now, but I took that to heart and I did enjoy the shit out of my travel and my time.
Right.
And I spent every dollar I had. A lot of my friends were saving for homes and I was off traveling the world, but I'm so glad I sort of lived my life in reverse because if I die tomorrow, like I know there's still places I want to go. There's still things I want to do,
Mm-hmm.
but I have like satisfied my itch of exploring, right? As a young person with good health, and so for me, that advice was the best advice I ever got.
That is probably the best advice you can get. I agree. I feel like I just love this story so much. First of all, I really want to go to Alaska and not when I'm in retirement, assuming I make it there. And it's just reminding me of my husband, who is, of the two of us, probably the one with the most wanderlust.
Mm.
Just always dreaming of trips, always designing trips, even if he doesn't go on them. Sometimes feeling really down when he doesn't take the trips, like when he's designed them. And I think like I am the homebody.
Mm-hmm.
I know that's in my human design as well. I am the homebody. I love travel, but it's definitely right out of my comfort zone. And he has been the one who's inspired me to follow that advice, which is go now. Go now. Let's explore. And I think that, years and years of doing that has helped me really realize that the time is now. For sure. There's no let's wait. I mean, sometimes there are times that are let's wait, but you got to have a real good reason to put it off. And it's not always financial. Sometimes you got to suck it up and spend the money, and you'll find out the reason why it was worth it when you get there. But you have to go. Yeah. So beautiful. Okay, this is a great segue into your life as a nomad. I think this is such a beautiful part of you that you don't always put together with the physician figure who worked in a hospital and all of that. And I love this because I think this is like the doorway to all the magical parts of you as well, which is all of that. So tell us about what it's like to find yourself with nomading, verb, and how that's really helped you reconnect to your purpose.
Yeah, I mean, again, going back to childhood, I wanted to be an explorer, like National Geographic was my favorite publication. My parents and grandparents got it, and I would just pour through every issue, just like soaking it in. And I grew up watching Marty Stouffer's Wild America, nature documentaries, and I was just like fascinated by the world and cultures. And, I didn't just want to go see, I wanted to be in it. I wanted to understand, and that's why I did global health, because I really loved learning about, the different like societal factors and social factors that make us do what we do or cause us to have certain diseases. And, I didn't travel much, like in college. Like my first big trip, I did a May master study abroad in Costa Rica for a month. And Costa Rica has been, one of my favorite countries since, that I've gone back to now so many times. It feels like a second home in a way, because it was my first international trip. It was my first long trip. I went, with a group from my college, but I didn't know anyone. I was solo, if you will. I was 19 and it was life-changing, and I fell in love with jungles on that trip. It was an ecology trip. So we were like mostly in, super remote places, getting eaten alive by every insect ever. And, I grew to love adventure travels. I really wanted to go to the off the beaten path places. I was not a fancy traveler at all. I did my master's thesis in Borneo, Indonesian Borneo, and was there a couple months. Indonesia, also one of my favorite countries. And the tropics really drew me, because of the global health piece. I was at the time really into infectious diseases, and that was my major. And I did some work in the malaria sector, and I loved my family. I love the US, but at the same time, it was just like, there's so much out there. How can someone live in one place? And a lot of it was, also just following my soul and my intuition. When I left ER, my ER residency was in DC. I took a job in Madagascar, which is probably the farthest away place you can get from the East Coast. Maybe Antarctica is a little further.
Mm-hmm.
And, I was there for a year. And that year was one of the most difficult in my life. It pushed me in ways I didn't know I could be pushed professionally, personally. But it was so good for me. It really was the best thing ever in being just, pushed out of the nest, because that was the year after I
Mm-hmm.
PR. And so I told you, I didn't have a plan. And so my plan became, okay, I want to go work overseas, and I'll figure it out there. And my path has always been, what is the next best step? I think
Mm-hmm.
Oprah has said that before, but I've often not known an outcome or exactly where I'm going, but I know where I'm being led, for my skiers out there. And I love skiing. It's just my favorite. It's like you're carving your fresh tracks down a mountain, and you're just,
Mm-hmm.
you have to adjust as you go, and you're going down the mountain, you are, but you're having fun along the way. There's going to be bumps. You might run into a tree or two or take some falls, but you're going down the mountain. And so for me, it's always been about following my soul and where my soul is leading me, and not, and that urge and sort of trust has grown with age and time. And, when I was younger, I was kind of afraid what other people thought. I move so much, and it just seemed I can't settle down, but there's a reason for that. It's just how I'm.
Mm-hmm.
And as I've aged and where I am now, I definitely have settled a lot more, and I've grown to love being stationary. It's helped provide a lot of rooting for me, and getting
Mm-hmm.
my work done and sharing my creative work with the world, But at the same time, I do need to keep moving in a lot of ways, because if I stay stuck too long, I get stagnant. I turn into a swamp. The water needs to keep flowing.
Ooh, that's a great metaphor, the swamp. I was picturing this tree, like you're rooted, but you branch out, but it's almost like if you stay too rooted, the roots can get root rot,
Yeah,
like too much water, like stagnant water, all of that. The water's got to move, the tree's got to branch out, all the things.
that's just how
Of
I'm made.
course.
Everyone is wired differently, and
Mm-hmm.
it took a long time for me to accept that about myself. Like, I
Mm-hmm.
thought there was something really wrong with me for many years. Um,
Oh, I hear you.
Now I totally am like, no, this is just me. Like, I'm just not, and I've met others like me. I think that has helped. I've met other nomads. I've met, San Francisco is a very transient city. So many people
Mm-hmm.
can go here all the time. And so that's been really helpful of like, okay, it's not just me. Culturally, where I'm from, this is not very common. It's many parts of the world, and especially now, digital nomading is a thing. Um, it's quite common. And so I don't feel like such a freak anymore. As I did once upon a time.
I love that part of that is you've grown into yourself and you've just really found that intuition. Not that it wasn't ever there, but like you've rooted into it as your true soul guide and your compass point. I love the part about often don't know where I'm going, but I know I'm being led. Beautiful. Okay. So here's where I want to contrast that with what you said about healthcare,
Mm-hmm.
which is from the very beginning, which is it's rooted in fear. Whereas I don't know where I'm going, but I know I'm being led is the 180 antithesis of that. So tell us okay, or give us a story, whatever feels right to you, about bridging that for yourself first. On going from rigid boxes, rules, fear, don't fail, don't eat, don't trust your body at all, don't listen to it, back to my soul is leading me, while still allowing yourself some containers and boxes so that you don't get too swept off the path and train track.
I would say a lot of it has been aging. Honestly, like having enough life experience, you know, crossing that 40 threshold and looking back and seeing all the situations. Oh, like that's why this happened. And it all ended up okay. At the time, it was terrible, but like
Mm-hmm.
there was a reason. And, taking those leaps of faith, like leaving ER when I left my role in primary care during the pandemic and sailed to Baja, I also didn't have a backup plan. I had a little money stashed for a few months, but I couldn't, survive a year on that. But I didn't know what I was doing next, but I knew I couldn't stay where I was. And so it's, the phrase leap and the net will appear. That has been very true for me. Every time I've done it, the universe has, gifted me an incredible opportunity or a good situation. And there's been a lot of painful falls along the way too, like life is up for learning and it's all lessons, right? And so I really try to not see things as failures anymore, of just like, oh, I should have made a different decision there, or I could have, I didn't. Now I have this situation I need to deal with. That was a good lesson for me. My intuition has rarely been wrong, I would say, in that, it's always led me where I needed to go. Sometimes that was a painful lesson.
Yeah, you're right.
We've become like this. I mean, not that you shouldn't take advice from other people, but I think other people are not you, and you do have to look at who you take your advice from. I often say, unless it's someone you really respect and admire, if this is someone you want to emulate or their life path is similar to yours, why would you take their advice? So I think we often take advice from the wrong sources and, don't listen to ourselves like we should. And so for me, it's really been perspective of like years of looking back and thinking, oh, wow, okay. It's like getting to the end of a book and you're like, wow, that makes sense now. But when I was in the middle of the book, necessarily like a really good mystery, if you will, like, who did it. So you get to the end, and so, I this new chapter I'm on is a very different one than I'm used to. A much more disciplined one, a much more very work focused one than I was the last 5 to 10 years, which have been a lot more about play and healing. And now it's very much turned to my work again. I see it as chapters too, in seasons of life, and that, it's always evolving and changing. And, the season I'm in now is very different than the one I was before. They're both beautiful, but got a little off tangent there, I think, from the original question.
We always get on tangents. That's exactly what's so beautiful about it. And this happens in every episode with everyone I'm interviewing, which is part and parcel because that's why I invited you. But those tangents are usually the place where you are illustrating the sink and the swim. That's the name of the podcast. And I always like to point it out because whoever's listening, you didn't shy away from the sink. Like you went from, for a very short period of your life, treading water, paddling furiously to stay afloat and ignoring everything below the surface because that's what you were trained to do. And you were uniquely wired to ignore. That achiever part is like, okay, whatever I got to do. And, had a really hard situation that forced you. Well, you had the choice, like you said, to sink and be like, nope, not doing this anymore. We're going to take a 90-degree turn and go this direction. And part of that 90-degree turn was burning it all down, traveling for a bit, doing what you needed to do to allow yourself to sink, which is just...
I've sank so many times.
You have sank so many times. And then you've risen and swum, and now you're swimming, and it looks maybe on the surface, on paper, right? Similar to that very first career move. And yet it's so different. And I think that's such a powerful lesson for women in healthcare. Back to our original conversation of, yep, there might be some zigzagging and twists and turns to get back to where you are now. And if you can create the resource and the safety to leap, the net will appear as long as you can trust your intuition, get some support, all you need to do for that. And then, lo and behold, it might look the same, but you come at it with a completely different energy.
Life is a spiral. It's not a line.
Yeah, exactly.
You revisit the same lessons again and again and again. And I think all of us, my personal beliefs, so we all have different karma and different life paths and lessons that will keep being presented to us in different ways. I know I do. And each time I've met with the same lesson, I'm coming at it with a new perspective, or there's a new angle that I need to learn. And I used to get really frustrated. I'm like, whoa, why am I here again? But now I see it as, oh, okay, I've been here before. What's different this time?
Exactly.
And how can I be different this time? I'm going through something right now that I've been through before many times, and there's some frustration there, but it's like learning to sit with that, learning to, frustration is my not self theme in human design. And when I know, something is getting to me, it's the frustration comes, I think, for many of us. And, so that's my cue of like, what's going on here? What was the lesson? And so it reminds me, the guy that wrote the book, Mark Manson, I think, the Give No Fucks guy. Do you remember? He, I think, was on a podcast or YouTube or something I saw, and he was talking about the sinking. And I didn't realize this, but Navy SEAL training, they do a lot of crazy things, but one of them is being tied up in a pool. I don't know if you've seen this before, but they tie their hands behind their back and maybe bind their feet too. Although I can't. Yeah, I think they bind their feet too. And they're supposed to last in this pool for like 20 minutes or something crazy. And they basically like have to sink to the bottom. They hold their breath, sink all the way down. It's a deep pool too. It's not like 6 feet here. And they push off the bottom and they kind of worm their way up to the top. And they're able to like take a breath, for a pause, and then they sink back down. And this is how they survive, right? This brutal training exercise that I know I would drown in. But
I'm already feeling anxious just hearing it. As a swimmer. Oh God, that's my worst fear.
You watch this video of them doing this, and it's like, oh yeah, this is what it's like when you sink, right? Like, you have to let yourself get to that bottom place to have the strength to like rise back up.
Yes.
I have had so many rock bottoms in my life, like I can't even count, honestly. But now I know, like, when that is coming or when that happens, I'm like, okay, now I have my strength. Now I can propel forward, and I don't fear it like I used to. I had a therapist point out to me once, like, you really catastrophize, like things start going wrong and you just spiral. I do. Like, the sky is falling. Oh my God. And now I'm like, okay, we can do this. We'll push off again. We can survive. And so that has been, I love the metaphor, the training exercise. And when I heard the name of your podcast, that was the first thing that popped in my mind was the Navy SEALs.
Exactly it. Yes. I've heard of this training exercise before. And what you just described is exactly months and months and months of me swirling this concept around, and trying to like give it words that were tangible and understandable. And as a swimmer, as my background, it was just perfect, obviously. Yeah. But it was deeper than that, obviously. And I think that what you said about resisting the sink, catastrophizing is one way of resisting, is the journey that is learned only with experience, because as your system starts to feel that it is sinking, of course it's going to resist it. That's its job. And the more you can learn how to regulate into the sink and stay there instead of resisting it and allow it, it's not just like, okay, I'm just going to lay here and take it. It's fine. That's not what we're saying. Surrender is very different. There can still be some very healthy fight responses and all those types of things that come in. Easier is not the word. The more seamless, the more fluid it is to reach the bottom and not necessarily bounce right back up. But like you said, worm your way back up. Yeah. It's not always easy on the climb out either. You can sink back down if you don't have the right balance of effort and trust. So with that, I think your story is such a beautiful example of that. So thank you for sharing it. Yeah. And with it, I think that coming back to this place where you're in perhaps a swimming phase, while there's still some sinking going on, you've now co-founded a startup. You are helping women who are burned out in healthcare. You are navigating the challenges that come along with that and being a wild and intense being, which are my people as well. So tell us about all that, like, embracing your human design, all the things.
Oh man. course. So starting the pandemic, I mentioned, I left my role that I had been in for about 2 years, and went on this beautiful walkabout. I call it my walkabout. I flew out to Baja. I was there for 6 months, and then I was in Seattle in the Pacific Northwest for 6 months. And then I did a solo road trip, just my dog and I, around the deserts in the American West for 6 months, a little over. So about 18 months of just journeying. And I was working. I had gotten a job in public health. So back to my sort of roots there. And I was gathering. That was my gathering phase of like, what is next? Because I knew I never wanted to be one thing, right? Like we've made that clear. But I knew, just being a primary care doctor in XYZ clinic was not my path, was never my path. I love primary care. I do family medicine. But I always have been obsessed with systems and how to create system change and seeing broad population level, problems and working on those. That's what really has driven me the most in my career. And, the problem with seeing problems is there's so many. Hard to know where to start. Yes. And so for me, as I was taking this time, at first I thought I wanted to go back into public health. And I did really enjoy my time. I worked for the state of California. And I enjoyed my time in that role. But I was starting to see, I've done a lot of advocacy and policy work in my career, but I realized the U.S. healthcare system, to me, feels like the Titanic. It's this giant, massive, complex ship that is sinking, unfortunately. Mm-hmm. And I don't say that lightly. This is something I think a lot about, and I realize in my work that I felt like I was trying to fix something that can't be fixed in any real way. Like we talk about healthcare reform and there's lots of good effort being done, and not saying that nothing is worthwhile, right? But from my perspective and my experience, we can spend time fixing the sinking ship, which is probably going to sink anyway, or create new ships. And it was a very slow realization for me, but a big one in that I want to be part of something new, something different, because I don't think, our healthcare system is designed to serve people with trauma, with chronic conditions in a way that, is meaningful. A system that perpetuates trauma and its workers cannot claim to heal it, right? And, we've known for decades, if not longer, that trauma is the root cause of chronic health conditions, like period, hands down, right? Anyone go ask ChatGPT right now. Just ask it that question. What is the number one root cause of chronic health conditions? Mm. It's the research and the data is so clear. And anyone that works in healthcare can 100% say this with certainty as well. However, it's not anyone's fault, but our system is not designed, it cannot treat trauma because it's not set up to, right? And so just like you're not going to ask your mechanic to fix your roof, we can't ask our healthcare system to heal our trauma. It's just not designed for that. And, and so this became super clear to me. And so I had gotten so much help from coaches, as I was going through this phase of transformation. And I fell in love with coaching, and I realized I'm really a coach at heart, actually. It's kind of what I've been trying to do my whole career, but really hard to do in 15-minute patient visits. And so I did coaching training, and I started working with people, and I realized people weren't really changing like I hoped they would or thought they might, right? I was doing all my tricks. And around this time was when I realized, I had my own trauma that had kept me stuck. And so I realized, okay, trauma is also what keeps people frozen and stuck in situations that they don't want to be in. They're too afraid to take the leap because, like you said, the functional freeze state. And so then I really did start doing deep dives into trauma healing, both for my own benefit and to help clients. And so I was working with healthcare workers, loving that. And then I met my co-founder randomly of our startup, Catbird, at a lunch. I was not looking for more work. I had a pretty bad taste in my mouth, to be honest, of healthcare startups living in the Bay and worked for two of them. Seen some pretty gross stuff, being here for so many years. And was just kind of tired of the rhetoric of, disrupting healthcare, blah, blah, blah. I can be a bit of a cynic, but, I just was like, I've heard it all. I've seen it all. Like, no. But she was different, and as I heard her vision, and she had already actually started the company, but she was looking for a medical counterpart. And everything she was describing was like the same visions I had. But I knew of like creating a new system for people, a new like platform for people looking for help. How do I recover from trauma? Like, where do I start? Who do I talk to? Like,
yes,
there's so much overwhelm and you're beginning that journey of like, where do I even begin? There's so many options. Like, what do I do next? And, it was this vision I'd had, but I knew I could not do this myself. It was just too big, too, much, too outside of my comfort zone and my strength set, honestly, my skill set. As I started to work with her and our team, there's 6 of us on the founding team, and, we all bring such different skills to the team. And it's this beautiful ecosystem of like, everybody is playing a role and pushing each other and working together, collaborating. It's been a little over a year now. And, it's been such a journey. Any startup undertaking is a lot, but it's been wonderful, and we've had huge traction and, getting new clients all the time. And we're learning. We tell clients like we're co-creating this with you. Like we're really in the learning stage of like what we need and want, versus just what we think. AI is playing a huge role. So AI, not to go off on that tangent, but has been, so massive in changing, I think, all things in our society, but in healthcare,
agree,
huge. And so, it has been the most beautiful and unexpected part of my journey. And it's been hard. I had a really hard decision. Like, do I do this thing knowing it will take some time away from my other roles, might slow down, my progression in a way, or, do I say no and just focus on what I was doing before? That's where that intuition came in of like, no, this is aligned. Like, this is part of my path, is like helping get this thing off the ground. It's been challenging for sure. Like, I have worked harder in the past year, I think, than I've worked since I was a resident, and but it's been so beautiful and so rewarding. And again, that season of life, I know it's not forever, that I'll have 3 jobs. For now, it's where I am, and it's wonderful. And I'm so grateful for the opportunity, to be honest. I'm loving, we're part of a new sort of what we call the direct to consumer movement in healthcare. We have a lot of people realizing, okay, insurance is not paying for anything. I can't see my doctor. A lot of people are just done and are like starting to take their health more into their own hands. Like Function Health is a perfect example of that. Dr. company and people paying out of pocket to get all the labs they want,
Yeah.
It's been amazing. And I am all for empowering people to democratize their healing, right? And we always say the CEO of your own health.
Amen.
And so, I've loved every second. It's been the most challenging year professionally, I think, but it's been so beautiful, and I'm so excited for what's to come.
Awesome. It comes as no surprise to me that you currently have 3 jobs, being a manifesting generator who's interested in everything, and who just lets your soul lead you. And it's such a parallel, like I said, but it's also a stark contrast to carrying all the things you were carrying early in your career, all your interest, all your things, because you've built your capacity to carry it. And maybe you will transition into 2 jobs or 1, or stay with 3. Who knows? I doubt you're going to stay there too long, because you'll get stagnant and you'll get root rot. That's just how we are as manifesting generators. I'm one too. And like you, I've gotten to where I no longer resist the sink, where I'm like, oh, it's time to move. And I guess I'm done with that chapter. And it's going to probably unveil some deep things to heal. So I guess I'm just going to go for it and trust that it's not going to be this horrible thing, because on the other side, it often looks really similar to what it was, but there's a new layer of unveiling that has created more capacity. So
Totally.
beautiful story.
Yeah. No, yeah, it's so beautiful. And yeah, not for everyone. And I think, again, with the focusing piece, I can't work on everything every day. So I really have learned, I'm learning a lot about time management and productivity,
Yes.
doing my chunks, learning how you work best, what type of work to do when I can do my meetings, when I need my solo admin this time, So, yeah.
So entrepreneurial. I'm going to butcher that word. We know where I'm going with it. Entrepreneurial. Yes. Using ours. Well, thank you for sharing that. And I think giving our audience just, I think that one thing that's difficult when you're at a starting phase of the sync is the vision, like what's possible. And I love how you highlighted, like, why would you take advice from someone else? It's not advice that we're offering. We're offering like a vision of like just a starting point for possibility. Like this is in the genre of what could be possible for you. You have to envision and create your own. And showing hope so that when you are approaching that sync phase or walking away from something or leaping, whatever it looks like, then there's this opportunity to go, okay, if she's gone through the dark depths and she's come out on the other side and she's smiling and breathing and she's okay, then maybe it will work for me too. Maybe. Not sure. Jury's out, but we'll see.
It's just scary, but
it's so scary.
It's also, there's always a lesson, like we talked about, like really leaning into that and leaning on friends for support. I had a moment a few months ago. I was on a trip with my best girlfriends, and I had a total breakdown with them where I just cried and sort of showed my pain that I've been carrying for a while. That we all live in different cities. We talk a lot, but had not seen each other in a while altogether. And they just literally held me like a baby. And then everyone started crying and like sharing, and it was the first time I'd let myself have that sort of emotional release, even with the people I'm closest with, It was what I needed so much, and so really leaning into your community and the people you love, trust, support you, know that we'll be there is so crucial. You don't need to go through those dark times alone.
Exactly. I think that we're supposed to heal in community. It's how we're designed, right?
A wise man once told me that grief is a social emotion, can't be felt alone. And I always think about that because it is very true. You really need other people to witness you sometimes. And I think that's the key piece of trauma healing is that I learned you can't do it all yourself, right? Because I try to do everything myself. I'm very hyper independent. And you really do need some type of support, whether that's, a therapist, your partner. Try to not offload everything on your partner. Having that system of support is like what is the key a lot.
100%. And someone who can really see you, all of you, and hold all of you. It's a sometimes a unicorn to find. I find that for me, it's a unicorn to find someone who's not going to pathologize your intensity or your eccentricities or your nuance or something like that. And making sure that those vulnerable parts of you are really held and seen in a safe way is just as important as every other part of this process we've been talking about. Okay, we're going to take a bit of a 90-degree turn here.
Okay.
From the deep and profound, which is, as I mentioned, this is just how we roll, to something a little bit more light and fun. This is how we conclude all of the episodes, which is the lightning round.
Okay, ready.
All right, I have 5 questions for you. They are, give me your gut response, whatever comes to mind first. All right, number 1. If you could be any animal other than a human, what would it be and why?
Ooh, this is the easy one. A hawk. I always want to fly. I love birds. And I love just their focus and, intensity. I think they're so beautiful. precision, how they fly, counts when they need to, the patience,
Right.
such patience there. And just the bird's eye view of everything, I think really summarizes how I see the world.
Mm-hmm. Like a hawk.
Yeah.
Love that. All right. Thank you for that one. All right. Jess is going to be a hawk. Number 2. If you could get a drink with 2 people, dead or alive, mysterious, real, or imaginary, who would they be and why?
Man. So there's this is so random, but there's this female pirate. She's Chinese. I forget her name, but I'm fascinated by her story. Just look up female Chinese pirate. You will find her. I'm like, why hasn't this been a movie yet? Hopefully it will be one day, but she sounds like a fascinating character.
Mm-hmm.
When she was active, but I think she was one of the most successful pirates in history, however you define that. Love to chat with her. I think Gloria Steinem. I love Gloria Steinem, and she's aging, but she's still so brilliant, and she's a nomad, fellow nomad. I've read her memoir and just love her. So those 2, Lady Pirate and Gloria Steinem.
That sounds correct. I feel like this is a good summary right here. Amazing. I need to put Gloria Steinem's memoir on my list, so thank you for mentioning that. Okay, number 3. Does pineapple belong on pizza?
I'd say it's a good occasional treat, not an everyday pizza, no.
Awesome. You're the first person who gave me a nuanced answer. Well, maybe depends.
A bite or 2, but then I'm over it.
Love this. Okay, love that. Number 4. I am a fly on the wall on an average Friday night for you. What do I see you doing?
Really working.
Great.
Yeah, Fridays are chill. Saturday, story. Fridays usually decompress. Maybe have a dinner party with friends. Yeah, it's usually my let go of the week.
Yeah.
Eat, get good sleep. Wake up early Saturday. Ready to conquer. Yeah.
Yeah, love that. Amazing. All right, number 5, last one. What is a hidden pleasure or obsession of yours that people might find surprising, weird, quirky, or questionable?
Oh man, I'm gonna get really, really raw here. I have a bit of an addiction to tarot readings on YouTube. I really need to stop, but I just love them, and no one knows this about me. It is definitely a secret. Not anymore, I guess, but yeah, and it's funny because I've only had one real life tarot reading. I love the virtual. There's so many characters, and they're just so funny.
They're funny.
I love
Yeah.
it. Yeah. Anyway, that's my secret.
Amazing.
No one will ever see my YouTube algorithm.
World premiere of your secret pleasure. Love this. Breaking news. Thank you for sharing that. Well, thank you for the lightning round questions. What do you want us to share about what's coming up for you? What do you want people to click on, go read about, join, all the things? Tell us that kind of stuff.
Oh man, something that came up for me yesterday, I think one of the questions you'd asked was one thing I would share with ambitious women. For me, my number one superpower, and I think the greatest skill we can all have, is knowing when to walk away, knowing when to quit. And there's a really great book. It's kind of aged a little now, but by Seth Godin, called The Dip. It's written in 2007. To be frank, I haven't read the whole thing. I listened to the summary on Blinkist, but basically, he talks about knowing when to quit situations. Like there's always a hard period when you're starting anything new or worthwhile. And knowing the discernment of knowing, okay, is this just a hard period, or is this, he calls them cul-de-sacs. Like, am I just stuck being that's never going to improve, or a cliff, something that's great at first, but is eventually going to, end in disaster. Knowing those 3 scenarios and when to call it quits before you lose too much time or money or energy, life years, is the best skill you can have. And I have quit so many things in my life. I think I've made it, clear in this episode how many times I've walked away from things that were just not in alignment with me. And it was at first really hard because, often when we quit things, we feel like a failure. We feel like we gave up. But again, life is for learning. For many of us, there's not just one path. And so learning when you might have taken a shortcut or a veered off your path, that way isn't going anywhere. You've hit you've hit a cliff or a wall or whatever, thick jungle. Time to backtrack, go a different way. And so that would be my takeaway. I would say for anyone listening, for anyone early in their career or even later, that I think will serve us all is knowing when to say enough's enough. And just dance.
Enough's enough. Hopefully not when you're completely on fire, but at the same time, sometimes that is, you said it, I wrote it down. Intuition is never wrong. Sometimes it leads you to painful lessons. Sometimes the fire is actually the painful lesson you needed, like you have so poignantly pointed out. Yeah. Well, so much wisdom shared with us today. I'll put some of this stuff in the show notes so people will go check you out and all your ventures that you have.
Awesome. Love to connect. So please reach out.
Yeah, y'all reach out. All right. Thanks for being here.
Thank you. Have a good day.